Cardiogenic shock. 1. Pathophysiology. Cardiogenic shock is a severe condition that occurs when the heart is unable to pump enough blood to meet the body's needs, resulting in an inadequate perfusion of vital organs. It is most commonly caused by extensive damage to the heart, particularly after a myocardial infarction heart attack, but can also result from other cardiac conditions such as severe heart failure or arrhythmias. Cardiogenic shock is a life-threatening emergency and is associated with high mortality if not promptly treated. 2. Onset and duration. 3. Prevalence. 4. Signs and symptoms. The clinical presentation of cardiogenic shock is dramatic, with signs of severe circulatory collapse, hypotension, tachycardia, cold, clammy skin, oliguria, low urine output, pulmonary congestion or edema, altered mental status, jugular venous distension JVD, chest pain. 5. Complications. Multi-organ failure, cardiac arrest, death, sepsis. 6. Causes and risk factors. The most common cause of cardiogenic shock is a large myocardial infarction heart attack that leads to substantial loss of the heart muscle's pumping ability. Other causes include cardiac causes, acute myocardial infarction AMI, heart failure, arrhythmias, valvular heart disease, cardiomyopathy, myocarditis. Non-cardiac causes, massive pulmonary embolism, severe hypoxia, cardiac tamponade. 7. Tests and diagnosis. A prompt and accurate diagnosis is critical for the management of cardiogenic shock. Diagnostic tests include electrocardiogram ECG, echocardiography, cardiac biomarkers, chest X-ray, hemodynamic monitoring, arterial blood gases ABG, complete blood count CBC and electrolyte panel. 8. Treatment and medications. The treatment of cardiogenic shock focuses on improving cardiac output, maintaining adequate blood pressure, and restoring perfusion to vital organs. Immediate management. Oxygen therapy, intravenous fluids, vasopressors, norepinephrine, dopamine, dobutamine. Advanced management. Revascularization PCI or CAB. Intra-aortic balloon pump IAP. Left ventricular assist device VAD. Extracorporeal membrane oxygenation ECMO. 9. Nursing points. Rapid assessment. Monitoring hemodynamics. Administering medications. Patient education.